Welcome to Springboard Studio's How-To series, where we talk about how to make healthcare more user-friendly. Each episode will cover a skill, process, or concept related to practical design thinking in healthcare, from abstract idea to its real-world impacts. Want to learn more about any given topic? Reach out to us at MGB Springboard Studio at mgb.org. Now, let's get started.
Today, I'll be introducing the Springboard Studio model, what we do and how we do it. I want to begin with a quote from Albert Einstein. If I had an hour to solve a problem, I'd spend 55 minutes thinking about the problem and 5 minutes thinking about the solution. This captures the essence of what we mean by practical design thinking in healthcare, which is our approach at Springboard. A quick primer on some terms. Design thinking is a methodology centered around solutions that are desirable, feasible, and viable, and is a process that takes many stakeholders and considerations into play. Human-centered design uses a similar process, but its primary focus is a solution's end user. Our work at Springboard can often volley between the two, and so you may hear us use these terms at times interchangeably. Either way, we use creative problem-solving techniques that put real people at the center and arrive at products and services that resonate. We center our approach with the values of humility and empathy. Humility to realize that our first concept of a problem is at best incomplete and at worst completely wrong. And empathy to be able to understand the vantage from the many stakeholders involved. So why use this approach in healthcare? Healthcare is in crisis. In the United States, we spend 16.5% of our GDP on healthcare. 39% more than the next highest nation. Yet we rank last among 10 high-income countries in overall health system performance. We are 10th in access and experience and 9th in healthcare efficiency. We must do better. And the good news is, we can. One reason we struggle is that healthcare has not nurtured creativity. The high-stakes nature of patient care, time constraints, and resource limitations leave little room to question, to imagine, or to explore. Yet many of our system's biggest challenges are rooted in a failure to ask, what is the real problem we are trying to solve? And then to follow this with, how might we address it? So where do we start? Practical design thinking is a way to reclaim our curiosity and channel it into creative problem solving. Our process relies on 4 key pillars. 1, design research. We start by deeply understanding the problem from perspectives of the many stakeholders involved: patients, clinicians, caregivers, administrators. Too often, solutions are designed far from those who experience the problem daily. Good solutions begin with extensive listening. 2nd, prototyping. We move quickly to what we call interim solutions. These are rough early versions that we test rapidly and can take many forms, from rough sketches of new workflows to physical mock-ups of products for us to test. We don't aim for perfection, we aim to learn, and we do so by testing and gathering feedback from our stakeholders on what works and what doesn't. Iteration allows us to refine our ideas so that solutions are more intuitive, compelling, and ultimately more likely to succeed. Perfection is often the enemy of progress. 3rd, implementation support. Change in healthcare is hard. Solutions must be tested in the real world with support. We work with frontline teams to help put these ideas into practice and then observe how they perform in context. And 4th, impact measurement. From the outset, we ask, what does success look like? How will we know we are making a difference? Defining success early ensures we are solving the right problem and creating real value. At the intersection of these 4 pillars lies the sweet spot: solutions that are desirable to people, feasible to implement, and viable within our health systems. This approach is not abstract, it's practical. It empowers the frontline teams, clinicians, and patients who know the problems best to co-create better ways forward. According to a Forrester Total Economic Impact study commissioned by IBM in 2018, organizations that have utilized human-centered design in other industries have seen an average 300% return on their investment and are 75% more efficient. We have seen numbers like these, and even better, already through implementing these approaches in healthcare. And there's a dual win here. We exist in an industry in which 45% of healthcare providers are burned out, driven by exhaustion, depersonalization, and a lack of agency. Yet, when providers, staff, and patients co-create solutions, they regain energy, community, and a sense of control. So what does this look like in practice? Let's look at a quick example of a project where we went through all 4 pillars, the mobility speedometer. A few years ago, we started a collaboration with Salem Hospital and Population Health Management to look at improving mobilization of patients in the inpatient setting. We held workshops and interviews with frontline providers to understand their challenges and began to ideate solutions that could address their needs. With their involvement, feedback, and buy-in, we designed a low-cost, intuitive, visual communication tool that shared a patient's mobility status and daily goals with the patient, their family, and their care team. We supported implementation at Salem and collected data in a 3-month pilot which showed patients move 300% more, the average objective decline in mobility during their stay decreased from 41% to 19%, and the length of stay decreased by 0.17 days in medicine patients and 0.25 days in surgical patients. Since our work at Salem, we continue to scale and iterate on the tool, adjusting it to different settings throughout the Mass General Brigham system, and continuing to improve its utility and ease of use. In other episodes of How To, we will get more in-depth into aspects of this and other work. To wrap up, curiosity is not a luxury. It is a necessity. Creativity is not a risk. It's our greatest untapped resource. We must do better. And with human-centered design, we can.
Thank you for listening to this episode in Springboard Studio's How To series. Want to hear about a topic we haven't covered yet? Let us know via email at mgbspringboardstudio@mgb.org.